Welcome to Between the Sheets, the non-judgmental podcast where we're going to cover various sexual health and wellness topics. I'm your host, Dr. Stephanie Zwonitzer. I'm a urology and sexual health nurse practitioner, and I love helping my patients and listeners discover and develop their most satisfying sexual experiences. Between the Sheets is here to normalize the conversations about sexual health and cover everything from basic anatomy to the most taboo topics and everything in between. Real talk, real pleasure, one episode at a time. So come on, let's get between the sheets. This episode is sponsored by Boston Scientific and its educational website on erectile dysfunction, edcure.com. One study estimated that more than 50% of men over the age of 40 have some degree of erectile dysfunction, which can be frustrating and confusing. Go to edcure.com to find information on erectile dysfunction and treatment options, including long-term treatment options offered by Boston Scientific. Boston Scientific does not endorse any statements or opinions expressed during this episode. Hey guys, welcome back to Between the Sheets. I have Dr. Lindsey Berkson here with us again today. She is a phenomenal hormone specialist, and she has recently put out a book called Oxytocin Medicine. So we're going to talk all things oxytocin today, and she also has a plethora of other things going on that I'm sure we'll touch on as well. Welcome. Thanks for being here.
Oh, thank you so much for having me get together and have these informative conversations, because it's very difficult to know in all the noise on social media and in what's going on, what are the facts and how can we keep ourselves safer?
Yes, I completely agree. There's so many influencers out there right now trying to give their opinion and what's going on. And some are MDs and some are regular people, and not all of it is great information.
Oh, isn't that true? So first of all, they stopped teaching hormones in medical school, osteopathic school, naturopathic school 25 years ago. So honestly, most doctors, they have no training, no formal training at all in hormones. So they've gotten it where they've gotten it and put their own spin on it. And some of it's accurate, but a lot of people are online trying to be famous and rich.
Yes.
And they want to say something that makes you feel like they know things that nobody else knows. Everyone else is wrong. And they somewhat sell that pitch with fear. So it's really good to, hear fact from fiction. And
Yes.
it's really sad because a lot of these people are OBGYNs. And that doesn't mean that their information is accurate.
Right. No, and that's one of the things that I appreciate about you so much. And I've watched many of your lectures. I went through the Bioidentical Hormone Training Academy, so I watched all of your stuff in there as well. And you are very diligent about knowing the science behind it, down to the molecular level and all of the ins and outs of these different hormones and what they do for us and how best to treat them, which I think is so amazing, because a lot of people are just like, well, yeah, just throw an estrogen patch on and that's going to fix everything. Well, not really. And that patch might not be the right choice for that person, or there's so much more that goes into it. And I appreciate how much you have over your career investigated this and put your time and energy into getting us the best information that we can.
Oh, thank you for saying that. They've made people first scared to death of hormones when that wasn't accurate. God, our 28th head of our FDA, Marty McCary,
Yeah.
he wrote in his book, Blind Spots, in the second chapter, he said, we lied that estrogen causes breast cancer. We lied. I was one of the co-authors, he said, of the Women's Health Initiative, and Jacques Rousseau, June 28th, 2002, gathered all the people that ran the Women's Health Initiative, which was looking at women every which way and how to keep them alive longer without toppling Medicare.
Mm-hmm.
And Jacques Rousseau said, I'm going to send out a press release that estrogen causes breast cancer. And everyone looked at each other. They went, what the heck? We don't have statistical significance on that. And he goes, dissension will not be tolerated. I'll ruin your careers if you speak out. I'll ruin your careers. McCary, our FDA head, says I have felt guilty for 25 years. They sent out that press release with no science to validate it. A week later, the Journal of the American Medical Association came out with a paper saying, hey, the WHI stopped prematurely, and they had no statistical significance to support stopping prematurely. But what did we do? We stopped teaching hormones in med schools, osteopathic schools, and naturopaths went along with it, it's sad to say. And, just recently, because he's felt like he has egg on his face and it was a travesty that hormones have been taken off the table to add to our health for both men and women and larger expanding age groups, they recently had FDA experts in women. I think it was around December 10th. And then they had FDA experts in men. That was about 2-3 weeks ago. And in that, Abraham Morgenthaler, that I've lectured with and had on my podcast, he said, testosterone really helps men not die prematurely. It's the number one hormone to prevent metabolic syndrome and depression and keep you living longer. And he said it's so safe that men with stage 4 prostate cancer can take testosterone and it won't cause more disease progression and it will enhance their quality of life. Why is that true for men and not true for women? And he opens up his lectures the same exact way that I did for many, many years. Why would Mother Nature make the very hormones that drive humanity, that drive evolution, that drive birth and reproduction? Why would Mother Nature make those hormones carcinogenic?
Right. Yeah, it doesn't make sense.
The other thing is that, we have inside our body what we call tumor suppressor
Mhm,
genes. They're supposed to really help the body see if there's growth out of control, because cancer is growth out of control in cells that don't know when to die.
mhm.
And they put the brake on that. They're brakes on growth out of control.
Yeah.
And they're called the overseers, the caretakers of our human genome, because you got to make sure we don't have growth out of control, because that's when the boogeyman comes down into the cells. And who protects these tumor suppressor genes? Estrogen and testosterone in men and women, unless there's sustained inflammation and sustained infections. So in our new Everything Breast Cancer, that's what we do, is we help providers understand how to find these infections, how to find this inflammation, how to optimize care, all based in science. But you can't get this from a standard of care oncologist. If there was an oncologist out there doing this, offering more stuff to do after standard of care,
Yeah.
we would have invited them. But they're not. And I've had cancer twice when I was much younger, which is
Mhm.
why I've got this fire in my belly to share this when this is not a sexy topic like oxytocin is a sexy topic.
Yes. Yes. But it's so true. I would just interviewed another woman last week that focuses on cancer and intimacy, because that's another area that the oncologist kind of just like, well, I kept you alive. What do we need to talk about that for? And not all, I'm sure there are some that address it, but that's such a great disservice to our patients for so many reasons, whether it's the cancer itself or the treatment that caused intimate side effects. We need to be addressing these. And so I'm glad that you're having this program that will help kind of cover more of the side effects and the comfort level of going through the cancer.
Like just an example. So when I was a distinguished hormone scholar at that estrogen, I call it a think tank, but it
Yeah.
was called the Center for Bioenvironmental Research at Tulane. And we would get together with the scientists who discovered how hormones first work, although hormones are a moving target. They keep growing and growing about all of our aspects. But when we were there, we were talking about how nuanced
Hmm.
hormones are. You can't just test a level and treat a patient and think you've got an optimal outcome. They're
Right.
very nuanced, and there's multiple steps that make up caretaking. So, in other words, you need to go to somebody who's had extra training, like you just said, you took the BHRT Academy training, because that gives you the bigger picture and all the nuances so that you can get effective care for your patients. And all of us want to live younger, longer, safer, healthier. We all do.
Yeah.
But it's harder and harder in today's dirty world, where we have so many pollutants in our air, food, water, amniotic fluid, in our rain. It's in our rain. There's no such thing as a totally 100% organic food anymore. But
Right.
then how do you really, and all of that is kryptonite to our hormones, just
Hmm.
kryptonite to our hormones. So we have to caretake our hormones. And we used to think hormones just signaled through lock and key. There was a binding pocket and the hormone was the key, and they went together, and then that expanded to hormone signal all cell membranes. And recently, in the last 2 years, we've discovered now that hormones can signal without receptors, without cell membranes. They can signal mitochondria. They can signal neurons in your brain, the glial cells that clean your brain. Hormones signal everything in your Wi-Fi system, but they're under attack. So you so want to go to a doctor, whether you're healthy and you want to stay healthy, or you've been diagnosed with a hormonally driven disease from breast cancer to prostate cancer to ovarian cancer. Who can I go to give the best of both worlds? Standard of care, but what else after standard of care? Go home and just cross your fingers and just wish that you don't get it back again? That's not a sensible way to go. But for example, melatonin. When I was at Tulane, David Blask's lab was underneath where the Tulane offices were and the labs were. He's the world's expert. He had a whole research lab dedicated to melatonin. Now he's also got one at Tufts. So he's got 2 research labs, one at Tulane and one at Tufts. And he's been working with the National Cancer Institute to show that all breast cancer patients have an issue with melatonin protection, because melatonin isn't just a sleep hormone. You fight cancer while you sleep at night. But if you take melatonin during any form of standard of care, if it's chemo, radiation, or surgery, you have less downstream negative side effects and you have better outcome. You're on tamoxifen, you take melatonin, you have better outcome. You're on an aromatase inhibitor, you take melatonin, but what do they tell you? You can't take anything. They scare the bejesus out of you.
Yeah.
We want to get beyond this bias in medicine. That's what we just saw in hormones. For 26 years, they told us hormones cause cancer when it wasn't a reality. Well, not everything we're being told in cancer care is a reality. But then what do you do for your patients or for yourself? And this is information whose time has come, because since the Spanish War, heart disease was the #1 killer. But cancer's about ready to overcome it. And I see a lot of patients these days who had endometrial cancer at 20. I just had a patient with ovarian cancer in her teens. This is a growing issue. And if we don't have providers trained in this, like we need providers trained in hormones, we're going to be in a big mess. And that's why it's great to have conversations like this. I
agree. It's such a disservice to our patients to just give them the surface level care. And,
I
there
like
are
that surface level care. Yeah, it's good. Good.
palliative care
Accurate.
comes into play for some side effects, right? Nausea and vomiting, they're good with helping with pain management, things like that. But a lot of people really go towards palliative medicine, towards end of life kind of care, versus it can come in at any point in time. But I think even more than that, to your point, is we need to have more providers educated in these nuances that can work with people to give them like optimal. I love that word. It's not that everything has to be normal or has to hit a certain mark, but for each individual patient to be optimized and live for them what is their best quality is so imperative. And I think a lot of times we get stuck in traditional medicine on the side of like, let's fix the problem. And when the problem is fixed, you're no longer my patient. Instead of, okay, we fixed the problem, but now we cause these 6 other things in your life.
Right.
And we got to work on
we're
those
trying to
too.
save you, but you're ruining your brains, your bones, and your heart in the interim. But like my experience, medicine, standard of care, I think, is designed to be able to sue doctors that aren't doing standard of care. That's why doctors are so scared of it.
Yeah.
But also, standard of care keeps doctors coloring within the lines and not thinking that much. It's kind of a recipe, an algorithmic medicine. And it's needed in some cases, but certainly not in all cases. If you only think within the lines, if you only color within the lines, it gets being nuts. So what happened to me was I was diagnosed with breast cancer in Santa Fe, New Mexico at St. Vincent's Hospital in Santa Fe 30 years ago. And I was the first woman in the United States to be diagnosed with the histologic, the cellular type that I had. Nobody else in the United States had ever been diagnosed with this. So they wanted to treat me like everybody else. But in the back of my mind, I was going, but they've never seen this type. How do they know? So while I was going, I had a radiologist that was a woman and an oncologist that was a man. They were a husband and wife team. And while I was going to them and getting things all organized, trying to be a dutiful patient, trying to stay safe, and nobody knew much about breast cancer 30 years ago,
Right.
I started sleuthing the literature if there was anything out there on this type of breast cancer. And lo and behold, in the Nordic countries, I found 2 papers, one on 30 women, one on 60 women, where they investigated this type of cancer and they had some things to say about it. So I put in calls to what we call the principal investigator, like Jacques Rousseau was when I was just chatting about the Women's Health Initiative. And I didn't hear back because of the time change and this and that. I kept calling and leaving messages at their laboratories. And because usually on a paper, they'll give you their email in the abstract so you can reach out, which is what I did. So I'm in the radiology department. I just had fluoroscopy to set up my grid to get radiation. I'm on the table. I swear to God, I believe in angels now. And the radiologist got called out of the room for some reason, and my phone rings in my purse. It was an old-fashioned phone because in those days, it was a large phone. And I pull it out, and lo and behold, it was one of the principal investigators. And I go, well, I'm getting the grid line. I'm about ready to start radiation. And he goes, don't do radiation. He goes, in Iceland and in Finland, radiation for this type of cancer is completely we tell doctors never, ever, ever, ever do it. Why? This type of cancer doesn't ever show up on mammogram. I had a mammogram saying I was clear, and a month later in the shower, I felt something. I went to my doctor. She said, you just had a mammogram. You'd be okay. But my intuition turned out that it was cancer. And he said, that's why we didn't find it on mammogram because it doesn't show up on mammogram. And if you get radiation, you get lumpy, bumpy, fibrous tissue, and you can't feel it if it does come back. So in 2 countries there, speaking to the principal investigator, he said, it is standard of care in our country to say never get radiation for these patients. So she walks into the room unbeknownst that I've just had this conversation across the globe. And I'm hopping off the table, starting to put my clothes on. And she's saying to me, wait, where are you going? And I'm going, I'm exiting stage right. I said, I just spoke, and I shared the entire conversation. And she looked at me, and as God is my witness, she said, F him. She used the whole word, F him. I don't know who this guy is over there. F him. If you don't do radiation, and she stuck her finger right in my nose, you are going to effing die. 3 times she said this to me. You are going to effing die. I couldn't believe it. But once she did that, it was like an explosion went off in my brain. Medicine is so color within the lines that she's willing to treat me the way they've always treated patients with no background in what I had and not listening to the man who was a principal investigator and published peer-reviewed paper. That's when I started digging deep. And for 3 decades now, I started digging deep, and why I went on hormone replacement 2.5 years after I was diagnosed.
Yeah. Yeah, it's incredible. I'm so proud of you for doing that for yourself. It's a lot of our patients don't advocate enough for themselves. I love that you were able to do that.
It's scary. It's really scary. And now that's why we're having this symposium. This is why I write these books, to try and take all this. Why is medicine so ruled by fear? What is that about? We want to give you a sense that you got a bigger and bigger tool bag. There's no guarantees. No one can give you a guarantee. If they do, you got to run for the hills. But there's so many things that are based in science that you can do, like lymphedema. I mean, I had lymphedema, and I talked with a researcher in Australia and translated it into a protocol that many of the times works. It takes about a year. But, usually lymphedema is something they don't have any answer for, but lymphatic massage. But there are answers. There are answers that are in peer-reviewed science. And, for example, the use of oxytocin. I have used oxytocin in practice now for 17, 18 years. And this new book that I wrote, it's 193 pages, but I have 556 citations. So there's like 35 pages of citations. And the interior editor called me up and said, is this right? What's going on? This is a small book with like a ton of scientific citations. That's because there's so many citations.
Right.
For example, your pancreas that oversees blood sugar, the cells that do that, the beta islet cells and the alpha islet cells, they're completely covered by oxytocin receptors. So you can use oxytocin nasal spray to help get better blood sugar control. It doesn't mean that you're going to get rid of diabetes or prediabetes, but it's going to be very helpful. So there's so many things known in science, but they're not selling a drug. And if they're not selling a drug, then the patient can miss out because it all comes down to money and
Yeah.
power and shareholders, putting profits over people. And
Mhm.
I'm so sick and tired of it. I'm a crusty old fart. I just
No,
turned
I'm right there.
77 and I can't have a filter on my mouth anymore.
I agree, though. I've been watching some of the Congress debates and how, CVS owns all these different components of healthcare. And that's why healthcare is that, those costs. And CVS isn't the only one. It's all of the insurance companies that own multiple things and different levels of healthcare. And that's why our premiums are crazy and they don't cover things because those companies at the end of the day are for-profit companies. And
Yeah.
so they are trying to make money off of us. And the whole system needs to get blown up. But that's another conversation for another day.
And so we want to talk about what we, the little person,
That's right.
can do. And there's lots that we can do. Honestly, my mother took a drug when she was pregnant with me. It made me not be able to have children and have 2 cancers and all kinds of health challenges. And here I am, not to say I never have health challenges, but here I am 3 years from 80 and I'm kayaking and going to the gym every day. I'm going to be in 4 different countries this year lecturing, and I'm living a really great life. And I'm having a lot of intimacy, the most intimacy that I've ever had. And so why fall apart when you're just kind of figuring life out
Yep.
and maybe have a few rupees in the bank? Why not really have more tools? So this oxytocin medicine book is about tools because oxytocin is so safe. It is sold over the counter up to 15 international units. It comes in international units. So you can
Okay.
get over the counter oxytocin and try it for a variety of issues. And when I was a keynote speaker in Calgary, Canada, a few years ago for a PCCA conference, there were OBGYNs there that said we couldn't get a hold of Pitocin, which is a pharmaceutical form of
Yeah.
oxytocin that they use to help women contract and bring the pregnancy on. They couldn't get a hold of it during COVID, so they use this over the counter oxytocin, and it worked really well, so well they were still going to keep using it.
Wow.
So you really can do a lot of things for yourself, but you got to get educated. Like, what are your options to do?
Yeah. So tell the listeners a little bit about, basic what is oxytocin and then kind of what you have found in your research, some areas that we can use it for.
Oxytocin is a hormone, a tiny, tiny, little itty bitty hormone. It's made up of 9 peptides called a nanopeptide. And it is one of the most powerful hormones we have. So size doesn't always matter.
Love that.
Big deal is the mother's body is filled with oxytocin at birth because it makes the uterus contract to cause birth and the baby to come out of the mom's body. And it also causes the breast to contract to let down milk. So
Mm.
one of its jobs, it has many, many, many jobs, is it's a contractile
Okay.
hormone. And in fact, its contracts helps the whole gut move food and fecal material through you. And people that are on the GLP-1 weight loss for other reasons you take it, that usually causes a paralysis of
Mhm.
contractions. You can pre-treat with oxytocin and take during the first month and kind of calm some of those symptoms down because it'll help have a little bit more contraction and less loss of contraction.
Okay.
But the mom's body her bloodstream is awash in oxytocin. So the baby's body is awash in
Mhm.
oxytocin. It's that safe that a brand new baby is awash in oxytocin. And it signals to the baby if oxytocin signals are working optimally, the word you just said.
Mhm.
It signals, welcome to planet Earth. It's a good place to be, and people are going to love you, and you should be really happy to be a member of the human race. And it also caretakes the entire gut so that it doesn't get damaged before the first breastfeeding, because birth is a pro-oxidative phenomena. So
Yeah.
oxytocin is an antioxidant set of molecules on roids.
Okay.
And it protects the gut. We know that it protects the baby's gut right when it's born. And you have oxytocin receptors all over your brain. People talk about trying to stay calm in a chaotic world. So calm is a parasympathetic aspect of our nervous system. Oxytocin rules the calm of our nervous system. Nature wants us to make love, not just to make love for reproduction, or we wouldn't get so many benefits from making love.
Right.
We get lots of benefits, and one of them is a release of oxytocin and other hormones that drench our bodies. Nature meant for hormones to be protective. Nature meant for us to be intimate, to share more of that protection. But women make more oxytocin when they orgasm than men do.
Okay.
It's also a bonding hormone. So
Hmm.
women have a little bit of a hard time with doing friends with benefits because the more and more women make love, the more and more bonded we get, but our brains make us do it. No matter how much we say, I'm going to be into ethical non-monogamy. I'm from Austin, Texas, and this is the epicenter of the universe in
Yeah.
polyamory and ethical non-monogamy. I didn't even know these words a few years ago. Oxytocin is an extraordinary hormone that has incredible science behind it to use it for a lot of medical and symptomatic interventions.
Mm.
For example, it's a food adaptogenic hormone.
Okay.
And there's multiple replicated studies where you can take it throughout the day 3, 4 times, 20 minutes before you eat. And
Hmm.
it's usually given in a nasal spray, although you can take it into your body by many delivery routes. That's what's termed how you get it into your body. And it reduces in people that are overweight your caloric intake and your desire to snack.
Hmm.
But on the other end of the continuum, it has multiple replicated studies in anorexics that are really having they have stress, PTSD over
Yeah.
eating, and it will reduce stress relationship with
Hmm.
food and allow anorexics to have a better relationship with food and to eat more. So it helps people who want to lose weight eat less, and it helps people who are fearful of gaining weight to be okay with eating more. So
Hmm.
I call it a hormone appetite adaptogen. Adaptogen means it helps you normalize on either end of the spectrum. That's pretty incredible.
Yeah. That's amazing. I did not know that about oxytocin. That is awesome.
And there's studies on it showing that it works for PTSD. One of my dear friends, Jim Hinsir, is a pharmacist, and we have lectured together a lot. He owns Las Colinas Pharmacy right outside of Dallas, and he is one of the kings of having protocols for PTSD for soldiers.
Hmm.
And one of the things that he uses in that protocol is oxytocin.
Hmm.
Also, oxytocin is so healing to the entire digestive tract. I've created a medicine that can be ordered through compounding pharmacies for any esophageal disorders, anyway from having difficulty swallowing to having issues like severe GERD, or
Hmm.
even to have what we call intestinal metaplasia, hyperplasia,
Yep.
or Barrett's esophagus, which are all bad, bad, icky stuff
Yeah.
happening to your esophagus that you want to make it better and not live on acid blockers your whole life.
Yeah, because they have a ton of side effects
Oh
that are not
my
good.
goodness. They just came out with a study showing that breast cancer survivors that go on and stay on acid blockers have a higher incidence of recurrence.
Oh, wow.
You cannot say we share a lot of incredible information.
Yeah.
Now I tried to get the University of Pennsylvania, Dr. Angela DeMichael, to speak for us. They just published a phase 2 trial where they were, what really gets cancer patients, all cancer patients, is these lurking, nasty cancer stem cells. They can also be called circulating dormant tumor cells. There's a tiny bit of difference between the two, but they're kind of cancer remnant cells that chemo and radiation doesn't get. Not
Mm.
all cancer patients have them. We don't know why some do and some don't, but the ones that do have a much higher risk of recurrence.
Hmm.
So we discussed how you might measure this in the serum and what you might do for it. And at the University of Pennsylvania, they want to figure out how to shut these cells up so that you can have a safer lifetime. So they ran it's a small little pilot trial, phase 2, but women who took hydroxychloroquine and rapamycin together in this small group that were followed that had these cells
Mhm.
and followed for 3.5 years had no 100% disease-free survival compared to women who were on each one alone versus women who just go home and cross your fingers and we got it all. You
Yeah.
cannot think that the way you lived before is the way you should go back to and cross your fingers and just wish to God, please God, don't let me have
Right.
this again. It's a sane way to think, but it's not a sane way to live. You got to have more tools. And oxytocin turns out to be an anti-cancer tool.
Hmm.
In fact, lovemaking and someone touching your breast, which you can also do on your own, but you get more oxytocin when you're with someone you really respect and love. It's interesting in my book, Sexy Brain, the literature is really clear. Women make more oxytocin if they're making love with someone they love. And if
Yeah.
they're making love with a friend with benefits, they make a little bit less.
Hmm.
That nature rewards you for a dynamic, heartfelt relationship. Wow, that's like a zinger.
Yeah. Oh, we might have to pause. I got to go get my fiance to rub my boobs a little bit here. Like what?
Maybe he could come over here and we can share. No. See, I'm in Austin and it's ethical polyamory. I just, these words
You
are
did say
crazy.
you're in the headquarters for it.
I did. Yeah, the median age here, because of the UT, University of Texas, is about 25. And most of the young people feel our parents all got divorced. So
Right.
let's try something different. And you gotta admire them. They're really calling for transparency.
Yeah.
They're
Yeah.
saying, hey, let's not cheat. Let's do it openly. But it's a different way of exploring different ways, right?
Yeah,
And
absolutely.
every generation has their own set of explorative behaviors. But nonetheless, oxytocin, we're meant to have our breasts touched. We're meant to make love. We're meant to release oxytocin because it turns out to be breast protective.
Hmm.
And it's not oxytocin nasal spray is not contraindicated when you have breast cancer. So all breast cancer patients get totally stressed out with the diagnosis and treatment. Lots
Yeah.
of studies on that. You can use oxytocin since it calms the nervous system down as a nasal spray to just start dealing with that anxiety because anxiety is so uncomfortable
Hmm.
and debilitating. But your doctors tell you can't do anything when you're in
Right.
cancer care, but oxytocin is not contraindicated through any cancer care. So knowledge is power to figure
Yeah.
out what's really going on, not just what the pharmaceutical companies are telling your providers that they then in a recipe tell you, not to say they're not helping to save your life, but
Hmm.
maybe they're doing one thing, but then they're missing out on a lot of other things that don't need to be missed out on.
Right.
There's
Well,
thousands of
sure,
articles
because
in peer review that never get paid attention to.
yeah, and we constantly have in the clinic world reps bringing in lunches, reps coming in talking to us, but they're all from drug manufacturers, imaging manufacturers, different things like that. We don't have somebody coming in and being like, "Hey guys, let's talk about over-the-counter oxytocin that no one's going to make money off of." Like they just don't. And so you're not exposed unless you as a provider go searching for information to make your patients' lives better. You're not handed this information because nobody's making money off of it. And that's such an unfortunate thing, but that's the reality. If there is a new prostate cancer drug on the market, they're coming into the urology office at least once a month to talk to us about it and remind us about it. But nobody's coming in saying, "Hey, have you thought about putting your guys on testosterone? Testosterone is really cheap. In fact, we take testosterone away from them."
It's crazy. So McCary held, if you go to YouTube, it's all free, and you put in FDA experts testosterone or FDA experts in estrogen, these incredible group of brilliant people that we have in these fields to speak. And Abraham Morgentaler says he gave a case report. He said, I have this guy that's had stage 4 prostate cancer for 10 years.
Mhm.
And the last 3 years, I gave him testosterone replacement. And he had a higher quality of life, no disease worsening. All men with prostate cancer, they can be on testosterone. That makes your life so much better. It
Mhm.
makes your life feel like you're human again
Yeah.
versus you're just a painful skeleton enduring the day when you've been on a lot of these treatments
Mhm.
without any hormones. Hormones make your Wi-Fi system work, and most of our ex-cancer patients are with frozen Wi-Fi
Mhm.
systems, and they feel miserable,
Yeah.
and they're crossing their fingers and praying cancer doesn't come back. So there's so much information, but how do you know who to really listen to? And I think one of the things that's made me have such a fire in my belly is I've been a patient so
Mhm.
often as well as a provider, kind of seeing things from both sides. I think when we go through med school, we should be in the last year a patient with some disease that we have to do the theatrics of and pretend
Yeah.
that we have this disease and go through the whole mock treatment for it so that you really know what it's like to be on both sides of the desk.
Yeah, I think that's a great idea. It really because nothing gives you a good perspective of of the patient's side without going through it yourself, or with a family member even to watch them go through something and you're like, oh my God, they don't tell you anything, or they don't talk to you about how did no one tell you this, or whatever it is. It's so different when you see it through the patient's perspective.
So one of the things I deal with a lot, but lately I've been being a non-primary consultant with breast cancer patients. That's been most of my focus. But much of my focus has been on the gut over my career. And I wrote a book, Healthy Digestion the Natural Way, that Wiley published. And back in the days, this is when they didn't even track how many sales there were. It sold like 1 million copies. And I've been working on a new book called Gut Medicine. That's a textbook. But I was dealing with a lot of inflammatory bowel disease, young female patients. And many of them are told they need to get segments of their colon removed or their complete colon removed.
Yeah.
So, because there's oxytocin receptors all over the gut, I would often give them oxytocin and hormones because estriol and progesterone
Mhm.
help regulate open and closing of the gut wall
Okay.
and identify their food sensitivities, give them low dose naltrexone, which reduces inflammation, and just really treat them individually. And I had 6 cases from Austin Regional Gastroenterology where the women were told they needed to have their colon removed or they need to be on medications all their lives. And within 6 to 7 months, with this kind of intervention, just based on physiology, they had totally disease free follow up
Mm.
colonoscopies. So I
Wow.
asked my gastroenterologist, Dr. Ziebert, if I could give a talk with the other gastroenterologists. So we got a little group together. It was all men. There were no female gastroenterologists. And they all said, "Oh my God, all the scientific journals you're citing, they're all from our journals. These are like renowned journals. We don't know any of this, but we would never do any of this. If we were going to do hormones, we'd send them to an endocrinologist or,
Yeah.
who doesn't do this because
Right.
medicine's so compartmentalized. The gastroenterologists don't want to use the fact that hormones receptors line the entire gut, and you can use that fact to help heal patients faster, quicker, better, fully, rather than making them sense of learned helplessness being maintained on medication forever. And in
Yeah.
fact, we have at our conference, we have 2 inspiring interview lunchtime series. So on Friday of our up and coming Everything Breast Cancer conference, we have the amazing Dr. Jill Carnahan.
Mm.
And she got aggressive breast cancer in med school. And then because of the treatment, because treatment is harsh,
Hmm.
she got of inflammatory bowel disease. So she
Okay.
was told she'd never totally be well with aggressive breast cancer,
Mm.
and she was going to have to be on drugs and prednisone intermittently and et cetera, with inflammatory bowel disease. And
Yeah.
she went on to really help heal herself and then specialize in these
Huh.
patients. And she shares how part of that healing was she took testosterone when she was early after her aggressive breast cancer. And now as she's older, she's on hormone replacement, not avoiding it like all breast cancer patients are told.
Right.
And she's not had inflammatory bowel disease since decades ago.
Hmm.
And so
Wow.
there's so much we're not told because we're ongoing customers for big pharma.
Right. Absolutely. Absolutely. I love this conversation. I love oxytocin and all the good things that it does. Remind people the name of the book, where they can find it, and your other stuff that you have going on.
Okay, so I've been working with patients for about 17, 18 years with oxytocin, and this book makes it a gentle, delicious little read. And each chapter gives you a different body system that you might consider using oxytocin for with the scientific citations. And the last chapter, chapter 12, is exactly for your provider how to write scripts for about 30 different conditions to send it into your compounding pharmacist.
Okay.
So it's a very user friendly book. It's called Oxytocin Medicine with this really great oxytocin molecule here. And in fact, this one picture, where do I have this one picture? I love this woman, this neuroscientist. I couldn't find her email, so we had
Yeah.
to cover up her face. She's finishing her PhD in neuroscience, and she had oxytocin tattooed on her torso. And she came
I
up to
love
me
it.
after lecturing on it, and I just thought that was amazing. It is an amazing molecule that you can use for many, many reasons, and your doctor's not trained in it.
Mhm.
But you can give this book to them and show them how to write the scripts for it, or you can start playing around with it over the counter. It's that safe. It's not dangerous. You just have to keep it in a refrigerator,
Okay.
and it will its shelf life is about 3 to 4 months. And usually if you spray it, it usually comes in a nasal spray. Most of the academic studies were done with it as a nasal spray. You put a little olive oil or jojoba oil in your nasal mucosa, because the first few days, the lining of your nostrils can get a little irritated, and then that usually goes away. I'm a pretty sturdy gal, so I don't seem to get much of these side effects that some people can get, but it's always good to be a little safe. But it's so safe, it's sold over the counter. And it's so safe that actually one of the studies if you get cancer metastases to bones, it hurts like hell. And this one patient had pain that was making them want to die. So they gave an epidural with oxytocin and were able to incredibly get rid of that pain for that patient. So it's also an analgesic. And it can be mixed with ketamine for major depressive disorders and get response and mood regulation within hours. It's quite extraordinary, but your doctor won't know. Gift your doctor this book and ask for a script, or play around with it yourself. Or you can always reach me at admin@drlindseyberkson.
Excellent. And I'm going to be running out and getting my copy because I need it for my patients. I love this so much. Thank you, Dr. Berkson, so much for being here. You're a delight always and so full of amazing information. Thank you.
I just love the way we have a conversation. Honestly, I feel right back at you, gal. I really do. And it makes me feel good because you get so exasperated. Like, this world is so chaotic that when you meet someone like you and we get to hang in this sacred space of heart to heart and belly to belly and brain to brain, it means a lot, and it reverberates out. So honestly, back at you, and thank you too.
Yes, absolutely. Everybody, don't forget to check out reviveish.com, where you can find me to work with as your hormone specialist.
Yay.
And we will see you next week. As always, have some fun between the sheets.
I love it.
Thank you for joining us and exploring sexual health topics here on Between the Sheets. New episodes are available every Wednesday. Please subscribe and rate our podcast so we can reach more listeners. And don't forget to tell your friends, partners, and anyone who will listen about Between the Sheets. Send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. It's all one word, podcastbetweenthesheets@gmail.com. Thanks for listening, and go have some fun between the sheets.